Is it visible? My screen? Hello?
Yes, ma'am.
Screen is visible?
Yes, ma'am.
Okay.
Yes, ma'am.
We will see the next disease of central nervous system. That is the Alzheimer's disease. This is one of the psychiatric diseases. Okay, very interesting today's topic. So before going to the actual disease, let you know the Alzheimer disease. What do you mean by Alzheimer disease? Are you seeing the picture Uri or another one? Which one? That picture, Amir Khan picture, Gajani. Gajani, you seen that one?
Yes, ma'am.
Yes, ma'am.
So you know now that one, short-term memory loss. Short-term memory loss. In the recent picture, Uri, that hero's mother, she was also affecting of that Alzheimer disease. That is the pure Alzheimer disease. In the Ghazni, that is the short-term memory loss is there. Here in the Uri picture, that mother showing the disease, that is the Alzheimer disease. So this is very interesting. So listen carefully. What do you mean by the Alzheimer disease? So we will see here. It is also a chronic neurological disorder or disease. That is the neurological disorder. It is a chronic neurodegenerative disease. Okay, neurodegenerative disease. We will clear again. I will explain. So usually start slowly and worsen over a period of time. Means what? It starts slowly, gradually, and then if we will not treat properly, it will worsen over a period of time. It takes time, but actually this starts from the age of the 60 or the 80, 70, isn't it? Older age, most probably having this type of disease. You will understand this one. Okay, so Alzheimer disease, it is a chronic neurodegenerative disease. Alzheimer disease is most common form of the dementia. Yesterday we seen that is the dementia, means cognition properly. That is the cognition. It is related to cognition. That is the memory. Dementia. Short term means memory loss. Here the memory loss, dementia. Affecting up to 70% of all the people with dementia. Actually, who are having the dementia, definitely it will progress. If we will not treat, then it causes further progression of the disease of the dementia. Means what? Alzheimer disease. Means what? It is affecting up to 70% of all the peoples with dementia who are having dementia. Obviously 70% in that people having the dementia causes Alzheimer disease. Okay, so we will see the etiology. Are you understood this one? What do you mean by Alzheimer disease? Alzheimer, it is related to cognition. It is related to memory loss. It is related to dementia. Dementia, the patients who are having, the individual who are having dementia, in that 70% they will progress into the Alzheimer disease. Okay, last stage, that is the Alzheimer disease. This is the memory loss. Okay, so very interesting. You see the first, the etiology. Etiology, what are the causes behind this one? Actually, this is all the part of the brain, isn't it? So we have to consider all these one. Etiology, cholinergic hypothesis, amyloid hypothesis, tau hypothesis, beta amyloid plex, neurofibrillary tangles, genetics, These are all. I will explain in detail this one. What do you mean by this hypothesis? Okay, so cholinergic hypothesis means what? It is a process that reduces the synthesis of acetylcholine in case of Alzheimer disease. Actually, acetylcholine, it is a neurotransmitter. It is a neurotransmitter. If this neurotransmitter is decreases or reduced, the synthesis of this acetylcholine, it is one of the cause of the Alzheimer disease. It is one of the cause of Alzheimer disease. That is reduction in the synthesis of the acetylcholine. Acetylcholine, actually, it is a neurotransmitter. If it is reduced, if the synthesis is reduced, then it is the cause of the Alzheimer disease. Actually, the hypothesis has limited acceptance. This one has limited acceptance because medication intended to treat the acetylcholine deficiency have limited utility, because if there is a low acetylcholine, we can't give the medicine as a acetylcholine, because actually acetylcholine, it is short, having a very short duration of action. So we can't treat by giving the acetylcholine directly to the patient. So this hypothesis has limited acceptance. Actually, it is there. If there is a acetylcholine reduction, definitely it causes the Alzheimer disease. But what happens? This acetylcholine, you will study in more detail in the second year chology, so that in detail the acetylcholine that you will study their cholinergic under the heading of cholinergic drugs. Okay, this acetylcholine has a very short term duration, means transient action is there, so there is a limited acceptance of this one. Okay, this is all about the cholinergic hypothesis. You have to keep in your mind that in that cholinergic hypothesis, this reduction in the acetylcholine causes Alzheimer disease. Okay, in very short. Now see the amyloid hypothesis. What happens here in the amyloid hypothesis? See here, the gene for the amyloid precursor protein, APP, you have to keep in your mind. APP, amyloid precursor protein, amyloid precursor protein. It is a gene. It is located on the chromosome 21. Where it is located? Located on the chromosome 21. Okay. A specific isomer of apolipoprotein is a risk factor of the Alzheimer disease. This is actually the risk factor of the Alzheimer disease. Apolipoprotein enhances, this lipoprotein enhances the breakdown of the beta amyloid, that beta amyloid, leading to excess buildup in the brain, and plaques of the amyloid are said to be cause of the Alzheimer disease. This beta amyloid plaques, deposition of this beta amyloid plaques causes the Alzheimer disease. This is one of the reason. But who is responsible for that? Who is responsible? The gene for the amyloid precursor protein. The gene for the amyloid precursor protein. This gene, it is located in the on the chromosome 21. Where it is located? Chromosome 21. This is the a specific isomer of the apolipoprotein. This is a risk factor for the Alzheimer disease. This isomer apolipoprotein, which increases the breakdown of the beta amyloid. Actually, this beta amyloid is responsible for this Alzheimer disease. If this beta amyloid, it's breakdown and it causes the plaques of the amyloid, that a deposition of this causes the Alzheimer diseases. Okay, who will break down this beta amyloid? This beta amyloid, this gene, the specific isomer of apolipoprotein. Okay, so due to this, it causes the breakdown of the beta amyloid. And what happens if it breaks down the beta amyloid? The excess buildup in the brain, it deposited in the brain. And the plex of these amyloid, all these deposition, these are leading to cause the Alzheimer disease. Means what you have to keep in your mind here, the beta amyloid. Due to whom? Due to the gene of amyloid precursor lipoprotein. Where it is located? It is located on the chromosome 21. It is actually the isoform of the apolipoprotein. What is the role of the apolipoprotein? Apolipoprotein? It breaks down the beta amyloid, and due to this deposition of this plex, the breakdown material of the beta amyloid, it causes the Alzheimer disease. Are you understood this one? This is very important, isn't it? So you have to keep in your mind this one. Are you understood all the theory behind this one? So we will go to the next. Two hypotheses understood, cholinergic hypothesis and amyloid hypothesis. Answer me quickly.
Yes, ma'am.
Okay, others are what they are doing, only sitting and listening like a bhajan kirtan, isn't it? Actually, if you don't want to talk, you can chat, no? Yes, no, something. So communication should be good, no? Otherwise, how can I go further one? If you don't know, if you don't understand this one, then just we will go the further one, other, how it is. So communicate properly, okay? Understood cholinergic hypothesis. In this cholinergic hypothesis, what is there? Reduction in the acetylcholine. Okay. And amyloid precursor, amyloid hypothesis in this what it is? It is due to the breakdown of the beta amyloid. And due to the deposition of these material causes what? Alzheimer disease. Okay. Now see here the tau hypothesis. Tau hypothesis. What is there in the tau hypothesis? Okay. What is there in the tau hypothesis? Alok Taure, repeat ma'am once again. Not understand, Alok? Unmute and tell. Alok?
No, ma'am. Repeat.
Okay. See here, it is very simple. Cholinergic hypothesis means what? Actually, hypothesis means what happens here in this cholinergic hypothesis, what the changes occur here. So, this acetylcholine, it is called as a cholinergic. Okay. Acetylcholine, it is a neurotransmitter. Next year, in the second year, chology, you will study under the cholinergic drugs, this disease. Okay. So cholinergic hypothesis. So that's why the name cholinergic. This acetylcholine, this is a neurotransmitter in our body. Okay. This neurotransmitter, actually balance should be there, isn't it? If imbalance, yesterday only I told you, if there is any imbalance, actually all in our body, everything should be equilibrium. Sympathetic and parasympathetic system. It comes under parasympathetic system, isn't it? So if this imbalance develops, then what happens? Our body will prone to some of the disease related to that type of the neurotransmitter. Okay, or hormones or enzymes. Okay, all the things should be in equilibrium. Okay. So, if there is any reduction in the acetylcholine, it is related to it is one of the cause of the Alzheimer disease. Are you understood now? So, when it is reduction, but we are not accepting this one because acetylcholine has the limited acceptance. Why there is limited acceptance? Because we are not giving externally the acetylcholine. It is not possible because it is having a transient action, very short action. It will decarboxylate immediately. So that's why it is not accepted by the people. Okay, the theory is not accepted. Are you understood now?
Yes, ma'am.
Okay, and here in the amyloid hypothesis, you keep in your mind like that only, where actually beta amyloid. Okay, main hero, that is the beta amyloid. Okay, what happens in this amyloid hypothesis? In the gene, which type of the gene? Amyloid precursor protein. The gene for the amyloid precursor protein is located on the chromosome 21. Okay. What happened this one? The specific isoform of the apolipoprotein is a risk factor of the Alzheimer disease. This causes which causes apolipoprotein, this isoform, that is the apolipoprotein, which enhances the breakdown of the beta amyloid. Okay, and due to that breakdown of the beta amyloid, it causes the beta amyloid, the breakdown material, the Plex will form, and that will deposited in the brain stem. Okay, and due to that, the Alzheimer disease causes. Are you getting now? This is a protein, amyloid precursor protein. Actually, which gene is it is a precursor, isn't it? The gene. Actually, gene means what? Are you knowing this one? Human anatomy and physiology.
Yes, ma'am.
Okay. Otherwise, I have to explain the things in the whatever it is there in the HAP. So these genes, actually, it is responsible for this. This is a precursor, no? Amyloid precursor protein. Okay. It is, these genes are located where it is located? Chromosome 21. Okay, if you not understood, you keep in your mind in detail, you don't study what is there in the amyloid hypothesis. Actually, the beta amyloid. The beta amyloid is especially when it is breakdown. This is needed. If this will break down into the pieces and it is deposited onto the brainstem, then what happens? It is leaded to the Alzheimer diseases. Alzheimer disease. And who is responsible to break down this beta amyloid? This apolipoprotein. This apolipoprotein. Which is this one apolipoprotein? It is a specific isoform. A specific isoform of the lipoprotein, which come from the genes of the amyloid precursor protein, APP, amyloid precursor protein. Actually, where it is located? In the chromosome, on the chromosome 21. Okay, this is the number for the chromosome. Okay. So you have to keep in your mind that one, beta amyloid, due to the breakdown of the beta amyloid, it causes deposition in the brain, and that causes the Alzheimer disease. Now understood this one? Hello?
Yes, ma'am. Yes, ma'am.
Now see here, tau hypothesis. Actually, this theory I explain only the 4 line. Actually, too much vast syllabus is there. If we will, I will explain. Actually, no use of this one. Only 2-3 lines. It is very in the simple manner. I tried to explain. Actually, this is the too much big theory behind this one. Okay, one book is there. Harsh Mohan. If you want to learn, you see that one, the reference book Harsh Mohan. Okay. Very simple manner, very simple technique, in a simple language I explained here. Okay. Within only 2-3 lines, which are essential for this one. Okay. Now see here the tau hypothesis. The hypothesis indicate that tau protein abnormalities initiates the disease cascading the AD. First I will read, then I will explain you. First, how much, because you are reading these notes. Okay. So you should understood the line, the meaning of these lines. So see here once again, it is the hypothesis indicates that. What is that hypothesis? That indicates in that the tau protein abnormalities in our body, in our brain, the tau proteins are there. If there is any abnormalities in the tau protein, then it initiates the Alzheimer disease. It is argued that hyperphosphorylated tau begins to pair with other thread of the tau. That means what? Here the aggregation will develop. Here the aggregation of tau proteins will develop. Okay. Then what happens? Finally, they forms the neurofibrillary tangles inside the nerve cells. Aggregation of these tau proteins, when they will aggregate, they forms the neurofibrillary tangles. Okay. As a result, the microtubules disintegrate, destroying the structure of cytoskeleton. You know all the structures, microtubules. Otherwise, I have to again explain this. Cytoskeleton means what, or microtubules means what. Already we have studied, isn't it, in the cell? So as a result, the microtubules disintegrate, destroying the structure of cytoskeleton. This finally leads to death of the cell. If it will disintegrate, if it will destroy the structure of cytoskeleton, see the structure of cell. First chapter only we have studied cell, isn't it, in the human anatomy physiology. So this causes the death of the cell. The biochemical mechanism and pathophysiology of the disease, actually it is not fully understood why this is happening, but this is the hypothesis. One of the scientists, they, according to him, it is imagine that one, this is one of the hypothesis, imagination. Maybe due to this tau hypothesis, maybe chances of Alzheimer disease, maybe that is the hypothesis. Okay, we are imagining due to this theory, due to this theory, due to this cholinergic hypothesis, due to amyloid hypothesis, due to tau hypothesis. That is the hypothesis, not clear cut, not clear cut. Actually, we are a pharmacist. You have to search this one. What is the reason behind this? These researchers are studying. Means now also they are studying. What is the main reason of this one? This is the hypothesis. Maybe, not exactly, not perfectly. Isn't it? Are you understood? Hypothesis means what? Maybe due to this, maybe due to this, but not clear cut. Okay. So one of the hypotheses, that is the tau. Okay. Tau proteins, the hypothesis indicates that the tau proteins abnormalities, due to the abnormalities of the tau protein, maybe there are the chances of causing the Alzheimer disease. They argued here, due to hyperphosphorylated tau, due to hyperphosphorylation, the tau begins to pair with the other thread of the tau. Means what? Aggregation will develop. One tau protein will aggregates to the other one, and finally they forms the neurofibrillary tangles. The tangles will form, isn't it, inside the nerve cell, inside the nerve cells. And what happens here due to these neurofibrillary tangles? Microtubules disintegrate. You studied in the this one cell, okay, organelles of the cell, microtubule, cytoskeleton, isn't it? That microtubules will disintegrate and destroying the structure of the cytoskeleton, and that leads to what? That leads to death of the cells. As there is a death of the cells, too many cells are there. If means only it is gradual. Before only I told you, it is a gradual development. Okay, it starts slowly but worsen over a period of time. Okay, gradual development of the disease. So one by one, the death of the cells happens here. The cells will dead, and due to that, it causes the Alzheimer disease. So biochemical mechanism and pathophysiology of the disease, still they are not understand, isn't it? Because what is the main reason behind this one? Actually, we need this one, perfect one, isn't it? Biochemical mechanism and all these things we need behind this one, but not understand clear cut. But here you have chance to research these Alzheimer disease. What is the cause behind this one? We have the good here. We can do the research here. Okay. So now next one, that is the beta amyloid plex. Now see here. What we studied here, same beta amyloid plex. What happens now? See here. The clumps of the protein called as beta amyloid. Okay, these beta amyloid. Clumps of the protein called beta amyloid may damage and destroy the brain cells. These breakdown products of the beta amyloid, they are deposited onto the nerve, onto the brain cells, and causes damaging of the nerve cell. They disturb. How they will disturb? When the material, the breakdown material will get deposited on the nerve cell, they interfere with cell to cell communication. There are interfering with the cell to cell communication. If no communication, nothing will happen. If I am teaching here with to you, if there is no communication, if there is a communication gap, then can you understand the things what I am teaching here? So that's why what happened, there should be a cell to cell communication should be there, one cell to another, another to another. So that's why the body movements, the body working is facilitated. Okay, but what happened due to deposition of this beta amyloid plex, the breakdown material, that is the plex, overall the brain cells, that will destroy the brain cells. How? By interfering the cell to cell communication. There is no any communication, that will interfere the communication. So that's why the individual can't work properly due to less communication. Okay, although the cause of the brain cell death is Alzheimer is not known, still we not known. The collection of the beta amyloid proteins on outside of the brain cells is the prime suspect. Means what? Actually, we are not knowing what is the cause behind this, but we can suspect that due to this is the hypothesis, all over the hypothesis. We understood due to this. Due to what? Because in the scanning we found the beta amyloid protein plex, isn't it? So that is the hypothesis. We are imagining, okay, due to this beta amyloid proteins, what happens? The brain cells are damaging. The brain cells are dying here due to what? Due to the beta amyloid proteins, deposition of the plex of the beta amyloid proteins. These are all hypotheses. Okay, so understood this one, beta amyloid plex, clumping of the protein called as a means aggregation. Aggregation. Clumps means what? Aggregation. Aggregation of the beta amyloid protein. It causes, it damages, it destroys the brain cell. How it will destroy? When they are deposited on the brain cell, the cell to cell communication gap is there. They interfere in the communication, isn't it? So what happened? There are progressively damaging, progressively dead of these cells. Due to that, the communication will not proper, and so that it progress the disease, that is the Alzheimer disease. Okay, now understood? Actually, this is the theory. Actually, one book theory is there. Okay, so very shortly I explained here. Okay, understood? Keep in your mind this much only. Understood, all of you? Now we will see to the neurofibrillary tangles. Okay, neurofibrillary tangles means what? The brain. This one only, before only I told you. Okay, all these one it aggregates and forms the neurofibrillary tangles. The brain cells depend on the internal support and transport system to carry the nutrients and other essential material to the neuron. This system requires normal structure and functioning of the protein called as a tau. Actually, here in the neurofibrillary tangles means what? All these tau proteins that will aggregate and that will forms the neurofibrillary tangles. Okay, and due to that aggregation, it leads to Alzheimer disease. So what happens here in this? The brain cells depends on the internal support, obviously, and transport system to carry the nutrients and other essential material to the neuron. Means when what is here? The communication. This system requires the normal structure and functioning of the protein called as a tau. This is the protein tau. Why it requires normal functioning? We require for what purpose? For what purpose? For communication purpose, isn't it? But if it is not normally functioning, due to that aggregation of or deposition of this one tau protein, it forms the neurofibrillary tangles, isn't it? So how it will work? It is not found normally structure and function, isn't it? So what happens? There will be damaging of the nerve cell. There is no any communication with the other cells, isn't it? Neuron to neuron. So what happens here? It progresses the disease like the Alzheimer disease. Now see here the genetics. Okay, genetics as the cause of the Alzheimer disease is indicated mutation, change in the gene, mutation. Okay, change in the any type of the structure, that is the any single protein also it is changed, that we called as a mutation in one of the three genes are linked to the AD, Alzheimer disease. Okay, the genes are those for the protein, namely amyloid precursor protein. Okay, amyloid precursor protein and presenilins and presenilins. Okay, these are the proteins, amyloid precursor protein and the presenilins 1 and 2. In addition, genome wide association studies have found 19 areas in the genes which are linked to risk of the Alzheimer disease. Means how many areas they found? 19 areas where the mutation takes place. If there is mutation, there is not that protein, whatever it is required for this purpose, for this functioning, normal functioning, it will not function normally, isn't it? So see here, amino acid proteins means what? Proteins means what? It is formed by the amino acids. So to 3 proteins, many of the amino acids combines to forms the protein. If the amino acid changed, one of the amino acid, if 10 amino acids forms one of the protein X and X, if one of the amino acid is changed, that formed protein is not perform the normal function. So there is a mutation. Mutation means what? Change in the structure, isn't it? So here also in this, if it is changed, which changed? Whatever the requires proteins, the tau proteins, beta amyloid, if it will change, then it causes what? It is responsible for the Alzheimer disease, causing the responsible of Alzheimer disease. Genetics, it will forms if the genes means what? That will transfer hereditary, no? It will transfer from one to the another, isn't it? Generation to generation. If it changes, then what happens? It leads to the risk for the Alzheimer disease. Okay, this genetics as the cause of the Alzheimer disease indicates mutation in one of the 3 genes linked to the Alzheimer disease. 3 genes responsible for that one. In that one, those for the protein, namely amyloid precursor protein. Here also changes, and the another one, that is the presensilin 1 and 2. This also, in addition, genome. Wide association studies have found how many areas? 19 areas in the genes which are linked to risk for the Alzheimer disease. This is the study where the changes occurs in the genes, the mutation occurs in the protein, and that's why this is the risk factor for the Alzheimer disease. These are all the etiology of this Alzheimer disease. Hypotheses are there, still we don't know. We are imagining that one due to because of this, because of this, because of this. Still we don't know the exact reason. Okay, by scanning, by diagnosis, with the help of that one, we imagining, that is the hypothesis. One of this one, that is the cholinergic hypothesis, amyloid hypothesis, tau hypothesis, beta amyloid plex, neurofibrillary tangles, and genetics. Okay, so these are all about the etiology. Now we will see the signs and symptoms. Signs and symptoms. Which are those? Confusion, disorientation. Step by step we will study. Mild to progression. Okay. So confusion is there, disorientation is there, personality changes such as becoming aggressive, irritation, demanding and suspicious to the others. Too much demanding nature is there, too much irritation, aggressive nature is there. Okay, hallucination and delusion, always in the what we called as a hallucination, well-beingness, feeling of well-beingness, hallucination in the dream. They are always in the dream, hallucination or delusion. Okay, language and speech problems, because the what it is, short-term memory loss is there. Na? Here the memory loss is there. Na? So they don't know the language also. They will forget the things, isn't it? The words they will forget. So there is a language problem, there is a speech problem. In detail we will see. Problems moving around without assistance. They need a proper assistance. Otherwise, they will be confusion. They will have the problems for everything, for moving from one place to another thing, the working condition, always they have a problem. How we will see here? The stages are there: pre-dementia, early stages, moderate stage, and advanced stage. Pre-dementia, actually first stage, what is there? Pre-dementia, loss of memory. Actually here, little loss of memory. Okay, the first noticeable deficit, it is the short-term memory loss. Okay, short memory loss. Short memory loss we seen in the Gajani. Okay, suddenly they don't they are not remembering the things, what to do. Sometimes we also feel like that, isn't it? We are keeping somewhere else our pen, our specs, or somewhere else, but we are not remembering. So like this, that is the short-term memory loss. Okay, which shows difficulty in remembering recently learned the facts and inability to acquire the new information. Additionally, actually, this is there. Okay, short-term memory loss is there. Along with this, inability to acquire the new information. The learning problem is there. Anything new learning. This one, pathophysiology, it is new subject to you. If any difficulties, if any problem, if cycling, we are learning to run the cycle, learning to swim, how to swim. There, the new things in that one, they have any problem. So this is the first stage. This is the first stage in the learning. Actually, short-term memory loss is there. Along with this, the learning problems are also there. Okay. In addition, problem with attentiveness, planning, flexibility, abstract thinking, impairments in the semantic memory, that is the memory of meanings. What is the meaning of this one? That is the semantic memory, and concept of relationships are the initial symptoms. Okay, these are the means initial stage. They are not learned properly because of this short-term memory loss. Okay, at this stage, apathy means what? Interest. At this stage, the interest may be observed. They don't have any type of interest here. Depressive symptoms, irritability, and reduced awareness are also common. They don't have any type of the interest. That is the apathy. It has also been termed as mild cognitive impairment. Mild cognitive impairment, actually it is between aging and dementia. As the age increases, there is increase in the dementia, increase in the memory loss. Actually, we used to say like that, isn't it? Our grandmother, our grandfather, okay, let it be. They are aged, no? So that they are not remembering. We usually say like this, isn't it? Because this disease is like that only. As the age increases, this will proceed, this will exaggerate, isn't it? But if you will do daily exercise, if you will have proper diet, no chances of this one. Okay, so we know that our PM, he is also of the old age, but he is not having the problem of dementia or all that one, isn't it? But in our home, we can say that, we are saying like that, isn't it? We usually say like that, they are older age, their memory, okay, let it be, they are not remembering all the things due to the age problem. But it is not like that. If we will in a proper exercise, in proper yoga, proper pranayama, and all the food diet properly, no disease will happen. Okay, so early stage. Now what happens here? Increasing the impairments of learning and memory. Okay, there is a problem in the learning and memory. They will not learn, they will refuse to learn. Memory already, this is short-term memory loss, isn't it? Can lead to definitive diagnosis. This is the main diagnosis. Starting of this disease. Okay, refuses to learning, and they are forgetting all the things, isn't it? Memory loss is there. In the few patient, difficulties in the language, because they are not remembering the proper words. So that's why there is a problem of the language. Executive function, perception, that is the agnosia means what? Agnosia means what? They are perception. Perception means what we call as a, that is the disorder, inability to recognize and identify the object. Sometimes they are not able to identify the object, or sometimes they are not recognize the individual also, persons also, isn't it? They are not remembering where they meet, where they, like that they will do, isn't it? Persons also they are not identify. Objects also they are not remembering. That is the agnosia. Okay, sometimes what happens, the movement, that is the apraxia, are more prominent than memory problems. They can't move properly. There is a problem in that, isn't it? More prominent here. Because of that, if the person is having that, individual is of old age, then having the problem of fracture, because they will fall down, no, they will not remember, they will not move properly because of these Alzheimer disease. Okay, this is the early stage of this one. Alzheimer disease does not affect all the memory capacities equally. Little bit they are knowing, little bit they are remembering, not forgetting all the techniques, all the things. Which are those? We will see. Older memories of life. This is called as episodic memory. Okay, facts learned. That is what are the facts they are not, that is they know all these facts learned. That is we called as a semantic memory. Don't keep in your mind this all one, that is the extra study. Okay, and memory of the body and how to do the things, they are not affected, they are lesser extent, that is they are affecting less. So when the disease is exaggerated, they will lose all these things. They will lose all types of this memory. Okay. So older memory, still they remember. Facts, how to learn, still they remember. Memory of the body, how to do the things, means if they wants to have the water, they how to do the meal, how to walk, still they remember. Little affect in the early stage. Okay, when the disease progression, it will affect all the moments, all the things. Okay, language problem lead to loss of the word fluency, because they are not getting the word. Sometimes we also feel no like that, what to tell for that, what to say like that, we are also doing like that, but they are little also the common words also they are not remembering. This patient may refer the written language. If they will follow the written language. If we will write and tell, then they will follow these things. So, but the things what we are talking, they are not understanding. So sometimes what happened for these people, they are using whiteboard. They are keeping that one. What to do next, what to do next. First one wake up, first that one wash, and then take the breakfast. Everything they are following the written language. We will see again. Okay. As the disease progresses, the patients of the Alzheimer disease may need assistance. Then they need the assistance of supervision, isn't it? We seen in the picture of Uri. Okay, they kept for their mother one assistant lady. Okay, with the most cognitively demanding activities. For all the activities, they require reminding, so that they will keep one supervision, one assistance. Okay, example, so that we will you can understand with the following example. Forgets which bills are paid, isn't it? These stages with this example. If you not remember all these one, take this example. Okay, you skip these one and write only the example, so that early stages we can understand, the examiner can understand. Forgets which type of the bill paid, can't remember the phone number, loses the things, can't remember the grocery list, arrives at the wrong times at the wrong places. When the place also they means not remembering which place is this one, which place is that one. So many times they leave the home, and where they will reach, they don't know. So this is the early stage. Okay, then moderate stage, increasing memory loss and confusing. The progression develops here. Okay, the increasing the memory loss and confusion may develop. Patients are unable to perform most of the common activities like the daily living, whatever the daily requirements are there, the daily activities are there from morning to the evening. Okay, they loses here that one, they are not remembering the things. Okay, reading and writing skills are progressively lost. Complex motor sequences are less coordinate, hence the risk of failing increases. If the patient is of older age, if they will fall, there is the brain damage is there. Okay, sorry, all the fractures are there, brain also will damage if they will fall on the brain, fall on the head. Okay. Memory problems become so worsened that the patient may not be able to recognize the close relatives. They don't understand, they don't recognize the close relatives also who are this one. Okay, long-term memory also becomes impaired. And here the old memories also they will hamper, they will impair. Okay. And common manifestation includes wandering, irritability, liable effects, leading to crying, excessive aggression, and resistance to caregiving. See, these problems are there with these people. Urination incontinence means they can't control the urine. These symptoms create stress for the relatives and careers. What happens due to this one? The family will get disturbed, the relatives will get disturbed, and this, if it develops for the middle age only, their career will hamper, isn't it? Because of this Alzheimer disease. This is the moderate stage. Now, example I will tell you so that it is easy to learn. Can't remember the places, can't find the right words, can't write the name, can't give the address, may act as a childish. Problems with the regarding the numbers, which number is there, that numbers also they are not remembering. Everything that is a memory loss only there. So many examples you can write by your own. Okay, difficulty in getting into the chair, they can't sit properly, isn't it? Forgets when last meals are eaten, everything they will means forget here, when they will eat, when they drink the milk, when they have the water, gradually loses interest in the food. They are not having any type of the interest, so that's why there is a confusion, the mood loss is there, nervousness is there, that's why there is irritability is there, aggressiveness is there, isn't it? So many examples you can write by your own. In the advanced stage, what is there? During this stage, the patient is completely dependent on the caregivers. They are not, they can't do anything, their own activities are so. Okay. Language is reduced to single words because they don't remember, no, can't remember these words. So that's why only single words they will talk. Even complete loss of the speech, sometimes loss of speech is there because complete loss of memory. Still the patients can understand and return the emotional signals, but little signals are there, emotional signals are there. Can't recognize the family, can't recognize the self image in the mirror also, so that's why they will talk with themselves only by seeing into the mirror. They feel that they are that person is the another person, so that's why they used to talk with that mirror image, isn't it? Loses the weight even with the food, even with the good diet. Okay. Little capacity with the self care, they are not taking their self care, can't control the bowels and bladder. Okay. Incontinence is there, difficulty in swallowing. Okay. The cause of the death is usually, actually this is not the actually cause of the death, but other problems are there, external factors, due to that problem there is a death. That is the, which are those external factors like the infection, ulcers or pneumonia, rather than the disease itself. Actually, the Alzheimer disease is not the cause of the death. The other causes are there to that leads to cause of the disease. Okay. Examples I will tell you so you understand. Looks in the mirror and talks to our own image. Okay. Self image, they will talk with themselves by seeing into the mirror. Need help with bathing, dressing, overall activity, daily activity, eating, toileting, everything they need help. May shout, may shout loudly, sometimes they will shout like anything, shout loudly, too much loudly. Sleeps more because they don't know anything, that's why they prefer to sleep, isn't it? How we can diagnose? How we can diagnose? A detailed history. Okay, medical history is there, checkup is there, throughout the physical and neurological examination. Thorough physical examination and neurological examination. In the neurological examination, by scanning and everything, we will get the beta amyloid plaques, tau proteins, the neurofibrillary tangles, the acetylcholine, everything we will get here, isn't it? The test of intellectual function. Here we will test the intellectual function test. Psychiatric assessment. Okay. The neuropsychological test we can perform here. Blood and urine test, which proteins are come in under that one. If the proteins are found in that blood and urine, then we will diagnose that the patient is having this and this disease. Okay. Lumbar puncture for cerebrospinal fluid test. They will test the cerebrospinal fluid test because this is the neuro degenerative disease, that is the brain disease is there. That's why they will check here the spinal fluid, cerebrospinal fluid, CSF fluid testing. And medical imagining, that is all the scannings they will do. Due to that scanning, they can understand the pictures of the brain. Okay. The picture by taking the all detailed pictures, photos of that brain, they understood, they diagnose the patient is, the individual is suffering from this and this disease. This is all about the diagnosis. And how the medication is there. According to that hypothesis, we can give the medications. Okay. Alzheimer disease, so precursor of the acetylcholine synthesis. There is a reduction in the acetylcholine, so we will prefer the precursor of the acetylcholine synthesis. We will give here. Okay. Cholinergic receptor agonist. Agonist we will give. Agonist, that is the helping. Which one? Cholinergic, that is the acetylcholine, bithnecol. Actually, acetylcholine we are not giving because of transient action. So that's why the precursor, that agonist, we will give same action of like that, only the acetylcholine, that is the bithnecol. You will study more in the second year. Okay. So bithnecol, that is the cholinergic receptor agonist. Cholinesterase inhibitor, that the enzyme which are inhibiting the acetylcholine, that we will inhibit. Okay, that is the physostigmine. Okay, cholinesterase inhibitor, the enzyme which are inhibiting, destroying the acetylcholine, which is this one, acetylcholine esterase enzyme, that we will inhibit. If we will block that enzyme, no there is the degradation of the, no there is reduction in the acetylcholine. So that's why it will set free into the brain. So which type of the drug? Cholinesterase inhibitor, which blocks this enzyme, which blocks the cholinesterase, so that it will set free the, because of blocking of this enzyme, it will set free the acetylcholine, where we need for this repairing of this disease. Okay. Newer drugs are also there, inhibitors of beta amyloid production, anti-inflammatory drugs, antioxidants. For every diseases we need the antioxidants. Okay. And amyloid beta vaccinations we can do. S3 receptor agonist are there. 2-3 more diseases, this treatment you have to keep in your mind. Gene therapy, neuronal stem cell therapy, estrogen. Okay. 2 or 3 days drug treatment you have to keep in your mind. Supportive treatment, supportive, which one we have to support for them? Always keep keys, wallets, mobile, all the things, essential things you have to keep at the specific area only, same place in the home, so they don't lose that one. Okay, so they didn't lost. Okay, develop the habit of carrying a mobile phone. For that individual, you have to keep the mobile phone. If they will lose anywhere, we have to trace out because of this mobile phone, with the location. Okay, with the location capability, so that you can call in case you lost or confused, and the people can track the location via the phone. That's why you have to keep with them compulsory the mobile phone. Program important phone numbers into the phone. Means what? Which should be first one, which should be second one, that programming we have to do and give to them. Okay, first one, that is the relatives. Okay, who are taking care That number they will dial, that number will be dialed. That programming you have to do and keep with them. Okay. Make sure regular appointments are on the same day at the same time as much as possible. Everything that is programmed one appointment, all the appointment. Okay. Use a calendar or whiteboard. You seen in the URI picture. This one that you have to use the whiteboard and always you write there the daily schedules of that one. They will read because they know the writing material. Okay, so that's why they will read and they will do the activities. Wash the hands, they will wash the hands. Wake up at this and this, they will wake up. Take the breakfast, they will do like that only. They know the written language. Okay. Remove excess furniture, clutter, and throw rugs. Means how you have to keep their room with less furniture, not too much material. Okay. Clutter, throwing rugs means what? All the waste material you should not keep with it. All the systematic one. This is the what area, what we can call it, that one. All the waste material you should not keep in their room. Okay. It should be aerated one. Okay. Specific one. Too much furniture, too much material, too much waste material, you should not keep that. Clean and tidy. Okay, their room should be clean and tidy. Install the sturdy handrails and stairways and in bathrooms. Means what? They are falling, no, due to that one. So that's why you have to install the sturdy handrails. So that way they will pick and they can sit, they can stand up. Okay. So where? In the bathrooms also and in the stairways also. Okay. That is for the balancing purpose. Ensure that shoes and slippers are comfortable. Otherwise what happen? They will fall down. They should give the good traction, isn't it? So that grip should be there. Grip should be there. Reduce the number of mirrors. You should not keep any type of the mirrors. Otherwise what they will do? They will see their self-image and they will talk with them. Okay. Exercise. You have to do with, means compulsory. That is the, you have to compulsory do with them. All the morning walk is there at least for 30 minutes. Okay. So that's why the movements are easy. Improve the mood and maintain the health of the joints, muscles and heart due to that activities. Okay. Exercise can also promote the restful sleep and prevent the constipation. Because of exercise, they prevent the constipation because they are habitual of sleeping, isn't it? So that they will promote the restful sleep and prevent the constipation due to exercise. Okay, what are the complications here? The final stage, they will what happen? Communicate expressions of the pain. Report symptoms of another illness. They can't report what they are, means because they can't talk, no, they are not remembering the words. So whatever is there inside the pain, inside any problem is there, they can't utter, they can't tell. These are the complications. Because of this, we also can't diagnose the what they are doing, isn't it? With what means what type of the pain inside them, we can't understand, isn't it? Notice or describe the medication side effects. Side effects are also there, but if we will notice, then only we can understand. Otherwise we can't, because they are not telling to us. In the terminal stage, brain changes to affect the physical functions like the swallowing, balancing, bowel and bladder control. In such situation, there are additional health problems are there. Which are those ones? Sometimes what happens, they are inhaling the food or liquid into the lungs. That's why the pneumonia is there. Okay. In the respiratory tract, the food or the liquid material, if Small particle will also go, what will happen? That causes the pneumonia. Pneumonia and other infections are there, agitation, aggregations, irritations is there, depression is there, falls are there. That's why the fracture is there. Malnutrition or dehydration is there. They are not remembering what to, how it. That's why supervision is needed. Supervision is needed. Caretakers are needed. Risk factor, what are the risk factor? Age. Age is the main one. Family history and genetics, sex, mild cognitive impairment, past head trauma if it is there, lifestyle and the heart health. Okay. Now the pathogenesis. Okay, pathogenesis, how the disease will progress here. Alzheimer disease is characterized by loss of neurons. Okay, loss of neurons and synapses in the cerebral cortex and certain subcortical regions. These are the, I think you have another lecture, no, at 12 o'clock. Shall we stop here only? 2 pages are there still. Or shall we complete here only?
Yes, ma'am.
We will complete, others are there, isn't it? So that's why the recorded material I will keep on the our class, so you can manage that one. Okay, neuropathy, neuropathology means how the pathogen is, how the disease progress, isn't it? We will see here. Alzheimer disease is characterized by loss of neurons, cholinergic neurons, isn't it? Before only we see. And the synapses in the cerebral cortex and certain subcortical regions are there. Due to that loss of neurons, there is a development of the Alzheimer disease. This loss results in gross atrophy, hardening of the affected region, including the degeneration in the temporal lobe and parietal lobe and parts of the frontal cortex, and that will sinew, and in the which part? In the cingulate gyrus. This is a part of the brain. Which type of the brain affected here? You see the temporal lobe, parietal lobe, the parts of the frontal lobe, frontal cortex, and cingulate gyrus. Gyrus, that is the part of the brain. Degeneration is also present in the brainstem nuclei, like the blue spot. Actually, histological TS, if we will see, then that type of the degeneration we can understand. The blue spots are there. Okay, due to the degeneration of these neurons. Degeneration of these neurons, we can see in the histology, in the histopathy, histological study, the blue spots, it will appear. So that's why we can understand there is a degeneration of that neurons. Okay, I will show you one of the time that one. Otherwise, I will include in your slide, that is the photos of that one. Okay. MRI and PET. Because of these scanning, we can study the photographs. We can take the photographs of the brain regions, and due to that one, we can understand which type of this one blue spot will understand because of this degeneration. Because of these scanning, we can understand. Okay, if this and this, we can understand here the neurotangle, this one beta amyloid plex are there, neurofibrillary tangles depositions are there, tau protein depositions are there. So that by scanning, we can understand that these are the hypotheses, so that both the amyloid plaques and neurofibrillary tangles are clearly visible by the microscopy. So that's why they are the hypothesis, okay, in the brains of these affiliated of the Alzheimer disease. The patients of the Alzheimer disease, if we will scan, there is a clear cut, we can see in that one, the amyloid plaques and neurofibrillary tangles, and that's why the hypothesis is based on that one. Okay. And next one, the plaques are dense, mostly insoluble deposition of the beta amyloid peptide and the cellular material outside and around the neurons. We can see here, that's why the hypotheses are there. Okay, understood now? Tangles, that is the neurofibrillary tangles, are aggregates of the microtubules associated with the protein tau, which has become a hyperphosphorylated and accumulated inside the cells themselves. Due to that deposition of all the material, clear cut we can see in that scanning. So that's why there is a hypothesis, because of this and this, there is the cause of the Alzheimer disease. Understood now this one, this one pathogenesis. Now we will see the biochemistry. So again we will clear the ideas. Enzymes acts on the amyloid precursor protein and cut it into the fragments. Before only we seen, isn't it, in the etiology? The beta amyloid fragments is the crucial in the formation of the sensile plex in the Alzheimer disease. These beta amyloid plaques are broken down due to these APP. Okay, and that will saturated, that will deposited onto the neurons, and this due to this the cell-to-cell communication gap is there. Cell-to-cell communication will not be there, and due to this causes what? Alzheimer disease. Plaques are made up of small peptides because of breaking down this protein. No, so small peptides. There are 39 to 43 amino acids in the length, called as amyloid beta amyloid or amyloid beta. So here only we can understand this one. Beta amyloid, that is the peptide. How much length is there? Single unit of the protein, that is the amino acids. How many amino acid length is there? 39 to 43 amino acid length is there. Okay. So if it is breakdown, if it is mutated, then what happens? There is a chances of Alzheimer disease. Amyloid beta is a fragment from the larger APP. Actually, amyloid beta, it is the fragment, one of the piece of the APP. And amyloid beta, it is formed from which one? 39 to 43 amino acids are there in the length. Amyloid beta is a fragment from the larger APP. APP is a transmembrane protein that penetrates through the neuron membrane. How it penetrates? Through the neuronal membranes. APP is a critical to neuron growth, survival, post-injury repair. Okay. In the Alzheimer disease, the unknown enzyme is proteolytic process causes the APP to be divided into smaller fragments. Due to that unknown protein, it breakdowns in the Alzheimer disease, and this is one of the cause of this Alzheimer disease. Alzheimer disease is also considered as tauopathy due to abnormal aggregation of the tau protein. Okay. And that will deposit it onto the neurons, and cell-to-cell communication will be hampered. Every neuron has a cytoskeleton, an internal support structure partly made up of the structures called as a microtubules. Before only we explained. Okay. These microtubules acts like the tracks guiding nutrients and molecules from the body of the ends of the axon to the back. These microtubules are essential for what? For providing the nutrients and the molecules from the body of the ends of the axon and back. Okay, these are essential. If it is hampers, if it will degenerate, if it will break down, due to all this one, it causes the Alzheimer disease. Okay, this completes our Alzheimer disease. Are you understood this one? Okay. Are you understood?
Yes, ma'am.
Shall we close here only? Shall we close here only, or we will end here only?
Yes, ma'am.